Hi all. Today we'll look at the essentials of pulse rate and rhythm, two core elements of cardiovascular assessment. A normal resting heart rate ranges from 50 to 95 beats per minute, but it must always be interpreted in context. A rate of 40 bpm may be normal in a well-conditioned young adult, while a seemingly normal rate of 65 bpm can be inappropriate in acute heart failure. Bradycardia is defined as a rate under 60 bpm and is commonly caused by medications, athletic conditioning, or dysfunction of the sinoatrial or atrioventricular node. Tachycardia, a rate above 100 bpm, is most often due to sinus tachycardia triggered by exercise, pain, fever, anxiety, hyperthyroidism, or sympathomimetic drugs. When assessing rhythm, determine whether the pulse is regular or irregular. Sinus rhythm is regular, although mild variation with breathing, known as sinus arrhythmia, is normal in young adults and athletes. During inspiration, parasympathetic tone drops and the heart rate rises, while expiration slows the rate again. Some rhythms show a regularly irregular pattern, such as intermittent extrasystoles or second-degree AV block. In contrast, atrial fibrillation produces an irregularly irregular pulse with no discernible pattern. The ventricular rate in atrial fibrillation can be very fast, sometimes approaching 200 beats per minute if untreated. Because ventricular filling varies from beat to beat, the pulse volume fluctuates and some beats may not generate a palpable pulse, creating a pulse deficit. You can measure this by subtracting the radial pulse rate from the apical rate heard on auscultation. Finally, respiration influences haemodynamics. Inspiration accelerates the pulse, lowers systolic pressure and jugular venous pressure and causes splitting of the second heart sound, while expiration slows the pulse, raises systolic pressure and jugular venous pressure and no splitting of second heart sound. Understanding these variations helps you distinguish normal physiology from arrhythmias that require further evaluation. Thank you.